9 o'clock promptly.
It's not streaming yet, just okay. It's setting up the meeting deadline.
Somebody has their mic on. If they can mute it. I don't
Good
really
morning,
want to hear.
everybody. Happy session. Great
Morning,
success.
Jim.
Good health. Take care, Mr. Chairman, and all. Grateful for all your good work. Madam President.
Good morning, everyone. Happy Friday.
Morning, Kevin.
Good morning, folks.
All right, good morning. I'd like to call the meeting to order. Would everybody please rise for the pledge? I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Senator Carrozza, could you please give us the prayer today?
Thank you, Chair Adams. And I spent a little time and I came across this passage. And in my Bible, it's titled God's Chosen Servant, Matthew 12, line 8. Here's my servant whom I have chosen, the one I love and with whom I am pleased. I will send my spirit upon him and he will announce my judgment to the nations. In prayer, Heavenly Father, we are grateful for this day and for the opportunity you have given us to work together as an Eastern Shore delegation. Today, with our presenters, we ask for special blessings for our municipal leaders and our hospice leaders, personnel, patients, and their families as they strive to provide the best constituent service and care to all. As we begin the 445th Maryland General Assembly with new senators, delegates, returning members, a new governor, lieutenant governor, comptroller, and attorney general, we ask for your guidance and wisdom in working together for all the people of Maryland. We thank you for the leadership of Governor Hogan and his administration and their support of our shore priorities. And as a delegation and with all of our partners, we ask for your grace to do our best to serve our constituents. In Jesus' name we say together, amen.
Amen. Thank you, Senator Carrozza. And good morning, everyone, members and guests. Welcome to the Eastern Shore Delegation meeting. Today's Friday, January 13th. We have two presenters today. The first is going to be Maryland Municipal League. And then the second is going to be our Eastern Shore Hospices. We'll follow that up with federal updates and then a more open agenda after that. So without further ado, I believe we have Maryland Municipal League, Teresa Coons and Angelica Bailey. And members, as we've done in years past, I'm new at this, but to the extent we're going to have questions, try to use that little hand up. You can certainly text me if you'd like to do that as well. And I'll do my best to try to take note of order as we move forward. So Maryland Municipal League, let's begin.
Thank you, Chairman. It's so good to see everyone. My name is Teresa Coons, formerly with the Realtors. So many of you know me for the last several sessions working mostly with Southern Maryland, but also as a contract lobbyist for the Realtors during the session. I am very happy to be with Maryland Municipal League. Been about 3 months now. Angelica, if you want to introduce yourself.
Good morning, everyone. Angelica Bailey Thupari. I'm the Director of Advocacy and Public Affairs for MML. This is my third session with the League and the first that will be fully in person. So I think I've met many of you virtually, maybe some of you in person, not quite everyone yet, but I'm looking forward to it.
And for any, I think most of you understand the municipality world. We're 157 cities and towns, and actually Eastern Shore is our biggest chapter. We have 57 in the Eastern Shore. You guys are the power wielding part of the state, and we want to make sure we have a great connection with you. If we can do anything on our end to make your Eastern Shore delegation, District 36, thank you again for the meeting yesterday. Anything we do to make your municipality stronger, let Angelica and I know. We have an open line of communication. We're looking forward to working together with all of you. I am just going to let Angelica take it off from here and talk about our priority.
Thanks, boss. So I think many of you are familiar with one of our big priorities this year, dealing with police accountability boards. Some of you were on the sponsor line last year, which is fantastic. But for those who may need a little bit of a refresher, in the 2021 session, the police reform bill from the Speaker's House Bill 671 passed. And part of that created police accountability boards and administrative charging committees, which is fantastic. We have no beef with that. The only problem is that it's only on the county level. And y'all on the Eastern Shore have 20 municipalities that have their own plans. And you guys have 20 municipalities that have their own police departments. Those municipalities are not allowed to create their own boards or committees. So one of our main goals this year, we view it as a simple tweak, just enabling legislation slipped in there that will allow municipalities that have the desire, the inclination, the resources to create their own. That's it, nice and easy. We've spoken with MACO. They have no opposition to this. In fact, I think some counties might be happy to see it. We've also spoken with presiding officers, leadership, and committee chairs. So we're optimistic that we can get meaningful municipal representation this year. We'd be very happy for your delegation support. We're happy to answer any questions. See, a simple tweak, short, sweet, and to the point.
Angelica, is that your the sole priority that we will talk about today?
That is our main priority. I think
Okay.
Teresa might also want to slip in something about cannabis revenue. As you know, municipalities have very few opportunities for raising our own revenue. And so we see the cannabis legislation as a strong opportunity for us as well.
Yes, we do see that as a first step into perhaps a longer term goal of getting municipal sales tax revenue and a portion of what is being taken. We know that a lot of our mayors and our town council members, they look at their buildings on the street and they're saying they cost us money. We never get a dollar from what they sell or what they're doing. We're trying to figure out what's the best way to help them get a piece of that pie that's already been taken. So cannabis, we feel, might be a good first step. If a municipality wants to have a growth or a retail store, if we can get a percentage of that back to the municipality to cover revenues, I think that'd be a great first step in the long-term goal of getting, we're one of few states. I think we're one of 6 states right now that does not get municipal revenues from sales tax.
Okay. So Teresa, on cannabis, are you unified with all the municipal governments on not only the revenue, but the reform? So in other words, is MML weighing in on what we think is going to be pending legislation this year coming? And so I serve on an Economic Matters Committee, and we'll have the regulation bill. So
Yeah,
where's
CT
MML?
mentioned that he's writing a lot of it.
Yes, he is. So have you given any thought to that and municipal leaders on just the policy part?
So I think there's 2 key points for us in the cannabis reform that we're going to see. One, we want to be able to give an opt-out. We would like our members to be able to say yes or no if they're going to have a location in their municipalities. Obviously, public safety resources, highways, we want to make sure our municipalities are willing to have it. And I know MACO also, I believe, is pushing for an opt-out on that as well. And we are going to review these legislations in Angelica's legislative committee. That's her area, but I will certainly, hoping with a sales tax revenue, that's really where I'd like to see us go and the economic impact.
Mm-hmm. Right. So I was in Colorado a couple of years ago. Of course, they have
Yes.
legalized cannabis there. And what I found is that there were a number of municipalities where you could not find the legal places to buy. Not that I was in business of buying, but I was actively curious, and that they were found in the counties. So I sense what you're saying, which is your local municipals want to have control over that decision making. Do you expect that
Yes,
to be a policy that we will be able to move through, or were you getting any pushback in some of your early meetings with the chairman and different policymakers?
The concern, I think, from the local government is that maybe opting out will not be an option given to us. We'd like to see that option.
Mm-hmm. Okay. Members, do you have any questions on those 2 topics?
Mr. Chairman, quick
Yes.
question, please. Just to go back, so if you do not get the opt-out, let me put it this way: if you are successful getting the opt-out and a municipality decides not to have any dispensaries within its limits, then obviously you are not seeking any type of the taxation revenue.
Yes, sir.
That goes hand in hand, right?
Absolutely.
I think that helps with the opt-out for sure. Okay.
Chairman, if I may, there might be one more topic that we're going to come before you this year is the Time to Care Act. As you know, we are looking at the regulations being out this June, and they're asking locals, government, county, and local government to start putting into the fund this October. And as you guys know, these budgets are mostly done already for this year and it started for next year. So that's something that we're looking at, is asking for a delay. But until we see the language, we're not sure where we're going, but we expect that to be something you hear from us on this session.
So Teresa, that's a policy that'll come through the committee again, and
Yes.
there's going to be two things that get decided this year. One's going to be the percentages that the employer versus the employee pay, and then what you're saying is municipal governments, you want to delay the beginning of the payment of the because we're going to be paying into these funds before the benefit is being offered to the employees. So you're asking for a delay.
Yes, and I think once we see that language, you'll hear an official statement from us. But as we understand in early phone calls with Angelica and others, regulations due in June, and October is when they expect to start paying into that fund, but not seeking payment until January 1, 25. So trying to build it up over about a year and a half. But unfortunately, our municipal budgets, and a lot of folks have small town staff, they're already done for this next fiscal year. So we know we need at least a delay for paying back into the fund.
Members, I don't see hands. It might just be because I'm not seeing it, but do we have any other questions for MML? Okay, seeing none. Teresa, Angelica, thank you very, very much for presenting to us. So I want to see, so the next group are the Eastern Shore Hospices. I see Heather, and is Chris and Monica there as well? I'm trying to see.
Yes,
We
yes.
are, yes.
Okay, so you're ready to go. Well, let's go
Okay.
ahead and start your presentation. Thank you.
Well, thank you, Chairman, and good morning to the full Eastern Shore delegation. Thank you for your continued support of our organizations, and thank you for allowing us to be with you today to give you a brief update on our programs and our needs. We have sent prior to, and I hope everybody received it, we've sent a fact sheet for each of our organizations electronically so that you all could view our statistics. I don't want to spend the time going over our stats today because they're self-explanatory for you all. And if you have any questions at the end, you can please feel free to ask any of us. But we would like to spend our time today on the most important issue, and that is preserving the certificate of need in the state of Maryland. We also, our second ask for the day is that, and we have included the flyer for this, we are having our Legislative Advocacy Day for the Hospice and Palliative Network of Maryland in Annapolis downtown on February 2nd from 3 to 8 p.m. And this year, for the first time, we are in collaboration with multiple other organizations. We are going to be there paired with Lifespan, Maryland National Capital Home Care Association, and the Maryland Association of Adult Day Care Services. So you will be able to meet with 4 associations at one time. So please hold that on your calendars. We'd love to see you all in person instead of just via Zoom. Our organizations are committed to excellence on the shore in hospice and palliative care. We are united and work collaboratively to care for everyone who needs us for hospice, palliative care, and hospice center beds and grief services on the shore. We are stronger together. Our 3 programs have the best working relationship that we have had in my tenure as a CEO at Compass. Again, I am Heather Guerreri, and I am the CEO of Compass. We serve Queen Anne's, Kent, and Caroline counties. And today I have with me Chris Shakuris, and he is Talbot Hospice, and Monica Escalante, and she is Coastal Hospice. We'd like to give you all just a brief overview of our programs, and then we will go into our needs with you all for the day. Here at Compass, we have seen a 38% increase in our palliative care program over the last year, and a 15% increase in the growth of our hospice. We also, in Caroline County, we have been working with the county commissioners in regards to having beds available for Caroline County residents. You all might know, but we have a 10-bed inpatient and hospice facility in Queen Anne's County that serves all three counties currently, Queen Anne's, Kent, and Caroline. But we are looking to provide some beds in Caroline County. We had originally, prior to COVID and the staffing shortages in healthcare and such, we had planned to build a building in Caroline. But after everything that's happened through COVID and further investigation, we have decided that it's probably best to try to have some beds within an existing facility in Caroline County. So thanks to the Caroline County Commissioner's support, and most importantly, Delegate Greist as well, we'll be working collaboratively over the next year or so to establish some beds there in Caroline County. Also, we have a great working relationship with our hospital systems, as you all probably well know, with the total cost of care. It is imperative that post-acute providers such as hospice and home health have great working relationships with hospitals so we can keep their costs down and have patients in the right place at the right time at the end of life. We also are working collaboratively with our mental health providers in Queen Anne's, Kent, and Caroline counties to ensure that people, we all know there's a deficit in mental health. And we, with our grief services program, we don't only provide grief services to patients' families who have been under our hospice services, but we provide it in all of the local school systems to children who have had a traumatic loss of suicide, car accidents, unfortunately, opioid overdoses. And we do one-on-one counseling for anybody, any adults as well, who have had those type of losses within our communities. And we also provide grief services. So we collaborate well with all of our mental health providers within our counties as well to ensure that we are helping to fill that gap. Now I'd like to turn it over to Chris with Talbot Hospice so he can give you a brief update on their program. Chris?
Yes, thanks, Heather. Good morning, everyone, and thank you for the opportunity to be here this morning. I will be brief and try not to be too redundant. Heather spoke and shared a good bit about what the three of our organizations do, and I am very proud and pleased to say how well we work collaboratively together. Just briefly, Talbot Hospice is the smallest of the Eastern Shore providers. We serve only Talbot Hospice. We have seen an increase, just as Heather mentioned, for her organization. We've seen a 7% increase over the last calendar year for hospice patients. We've seen another 17% increase for palliative care patients that we serve, and a 250% increase in our Pathways program, which is a supportive care program that is managed by our volunteer office, where we provide volunteers to support patients and or their loved ones in their home. So again, continued growth as we try to do our best to serve the community. As Heather mentioned, we too, and the same with Coastal, we collaborate with a number of organizations in the community to provide services, and many of the programs and services that we provide do not have a source of reimbursement. So we do rely on the generosity and support of our community, and we're very thankful and appreciative for those that do support us. Bereavement services, as Heather mentioned, is one of those areas that many people don't recognize that we provide, all of us provide to our communities, not just to hospice patients and their loved ones, but many others in the community, as Heather also mentioned. We too partner with community programs such as here for all seasons, and we offer a Spanish-speaking support group. That's been extremely helpful, and we partner with the hospital here in Easton, running a perinatal and infant loss bereavement program. So again, a great deal of effort in working collaboratively with community organizations as we try our best to serve the community. And the last thing that I'll mention, and Heather mentioned this as well, and I'll turn it over soon to Monica, where we'll touch on this some more. One of the biggest areas of concern where we continue to need your help and support is around the CON. Compass, Coastal, Talbot Hospice, and the remaining hospice single provider jurisdictions. We're concerned about any potential changes to the CON regulations, which could have a significant adverse impact on us and our ability to service the community. And as I mentioned, our colleague, Monica Escalante, will share some more information. So with that, I will turn it over to Monica.
Am I now?
Hello,
good morning. I think somebody is.
Joanne, we can hear you.
How do I do that? Okay, I'm Monica Escalante, I'm president of Coastal Hospice, and so many familiar faces in the audience today. It's a pleasure to be with you.
You see the speaker's face, not yours, right? That's because you're muted. You're overriding.
Monica, hold on one second.
I'm here for you.
There we go.
Thank you so much. Thank you. Well, here in the Lower Shore, we've experienced paramount growth in the last 15 months. We've grown by 40%. To this growth, we had to hire 96 new staff members. And imagine that's 36% of our workforce. In total, we have about 265 employees and 96 of them are new. We had to hire them, train them, and put them to work to meet the needs of our community. And this was a big challenge because our community and our local hospitals are severely understaffed. We're competing with them. They are offering $20,000 sign-up bonus. So it's been a challenge to keep up with the growth and continue to offer high quality services to our community. We also licensed 26 beds for acute care. Last year we had 14, and this is something that Heather alluded to. What we see here in the Lower Shore is the increasing number of elderly couples, and the caregiver is as fragile as the patient that we're caring for. So the need for residential beds, the need for inpatient care goes up by the minute. So that's why we licensed 26 beds. On our residential units, the Ansel House, please know half of the care that we provide there is charity care. These are people that have no means to pay and they don't have other place to go or caregivers to care for them. So this is very important charity work that we do. This past year, we also received a grant to train clergy in the African American faith communities. We're trying to make inroads in the African American communities with every tool that we have to increase the trust and the utilization of our services, because that's probably the one area of improvement that we see in our territory. So we received a grant and we're about to finish training 4 of the largest African American churches in the Lower Shore. We also have on staff right now 4 certified doulas, and this is a new trend in end of life. And these doulas build trust with communities, vulnerable communities for the most part, to bring them on board earlier. So this is an additional effort that we're trying to do. Coastal Hospice is a nonprofit hospice that serves the Lower Shore, Dorchester, Wacomico, Worcester, and Somerset. We've been authorized by the Maryland Healthcare Commission to do that. But please know that recently the Maryland Healthcare Commission has indicated that they think Dorchester County is not receiving high quality hospice care. Now, mind that all of our hospices, Compass, Talbot, and Coastal, are a 4-star hospice. There's a survey, a family survey. You have this information in the fact sheets that we sent electronically. All of our hospices are among the best in the state and in the nation. But still, regardless of that, the Maryland Healthcare Commission is saying that Dorchester County is not receiving quality hospice care, and they are considering opening the region, the lower region, for additional providers. Coastal Hospice scores in the CMS and Maryland metrics, in all of them above the national and the state averages. So it is hard to understand why Dorchester would be receiving poor quality. But that put aside, Please, and some of you know, some of you represent Dorchester County here in the audience, is the largest county in Maryland, Dorchester, with the second lowest population. Cambridge is the only significant population center. So the very rural nature of this county and the sparse population and overall lower utilization of medical services. And that's not only end-of-life care, that extends to primary care. There's less nursing homes, there's less extended care facilities as well. And all of these presents challenges to any medical service provider who's trying to support people in their homes. The reason the Maryland Healthcare Commission is considering opening up 4 counties, now it's adding Worcester and Wacomico to this, is because no new provider would want to go and serve Dorchester alone. But by adding Worcester and Wacomico to the region, that's going to entice new providers to not go to Dorchester and just stay with the growing populations in Wacomico and Worcester. So this solution that is proposed is not going to solve the identified problem, if that problem actually existed. So in addition, this danger of new providers coming to the lower shore or the Eastern Shore at all, as a whole, will place the viability of coastal hospice in particular in danger. As you know, we experience unprecedented labor pressures all over healthcare. And although we hired 96 new employees last year, we still have unfilled and open positions. As of today, we have 5 open positions. Of course, when I talk to the local hospital, Tidal Health, they make me feel a lot better because they have 70 open nursing positions right now. The understaff is so severe that I think they are hiring nurses from the Philippines. And so that's just to paint the picture of labor workforce right now. So in this context, our ask, the 3 hospices here that I want to tell you are some of the best hospices in the nation, are asking our delegation to support our efforts in requesting the Maryland Healthcare Commission not to open the Eastern Shore and specifically the Lower Shore for additional providers. It is imperative that a pause is placed in the opening of this region, and it's considered that the needs are being met. Not only due to the staffing issues, the inability to hire locally. This pause will allow the 3 hospices, Coastal, Compass, and Talbot, to explore a better solution. We would like to have a collaborative approach among these 3 non-for-profits that are offering high quality care, to combine our forces to probably start some combined efforts to offer palliative care. Now, palliative care is the pre-hospice stage that allows to build trust with vulnerable communities. And that's where the utilization is lower than in other communities. So that's our ask. Please support our efforts, putting a pause to the opening of the Lower Shore or the Eastern Shore as a whole, and let us continue to provide top quality of care to our communities. Thank you.
Thanks, Monica. Before I'll ask it to open it up to questions, but I again just want to end by thanking you all for your time today. Thank you for your continued support. As I said, we welcome questions, in particular, probably in regards to the preservation of the certificate of need in the state of Maryland and on the Eastern Shore. But again, to end, our 2 asks are to preserve the CON, and to please attend our Together Moving Forward Legislative Advocacy Day in Annapolis on February 2nd from 3 to 8. And please spread the word to the other legislators that you all know. And thank you again. Any questions?
Okay, thank you very much. And we as a delegation love and appreciate the work that you do. I know that my family benefited a number of years ago with hospice care, and can resonate with what you're saying when you say that hospice care is more than just help for someone that's going through end of life, but it's also for the families. So very meaningful, and thank you for all that you do. Senator Carrozza, you have the first question.
Thank you, Chair Adams, and thank you so much for the hospice presentations. I'll be brief with two questions. One, I wanted to follow up particularly on the certificate of need issue. You talked about the hospices having combined efforts to increase end-of-life services, and particularly with the pre-hospice stages. I wanted to better understand the importance of the pre-hospice stages. And my second question is to the workforce shortage. Specifically, we have the University of Maryland Eastern Shore Pharmacy and Healthcare Professions School and those students, and to see if they can be part of the solution as volunteers to help address the workforce shortage.
Great. Well, thank you, Senator. Monica might want to address some of this as well, but what I would say in regards to the certificate of need and the palliative care and the collaboration among our 3 hospices on the shore is one of the, instead of them opening up the certificate of need in the state of Maryland, the Maryland Healthcare Commission, we are trying to come up with a solution that the 3 organizations can collaborate and cover each other's territory. So whichever one is closest, like I am closest in my territory really to Talbot. So if there was a patient who wanted our organization or had an issue with Talbot or any of our organizations and didn't want us, we would go in and take care of that patient for Talbot. Same with Talbot helping Coastal in their areas. And instead of the other issue is having for-profits come in. And that's a concern of ours as nonprofits. They operate very differently. They don't fundraise. They don't offer the same quality of care. Other states have proven that when the certificate of need is opened up, and the floodgates are with for-profits mostly, and they come in, and as Monica alluded to before, they will go to the areas that are most populated and take those patients from you, and then our organizations that have been serving the communities for 30 plus years and nonprofit will be driving to Rock Hall and to all of the other areas that are not as populated and obviously more travel and expense.
In addition to that, we all have good palliative care programs well established, and this could be a same combined effort. And we know that vulnerable populations distrust some of the system services. So the home-based palliative or palliative consults are a way to ease them into utilization. And I don't think, I think we can.
At the program level, we're doing a lot.
I think Scott Werner is not muted. There you go. Thanks.
So that's one part. The other part is your idea of utilizing students or, years ago in the hospice industry, we wanted only seasoned nurses to work for our hospices because they have a great deal of autonomy, and you really need to make decisions, good decisions in the homes. And what we have now is a robust preceptor program. So now we can take newly graduated nurses. It takes more effort though. We need to follow them for longer periods of time, coach them, ease them into the work so we can retain them. Because for a new nurse, it's harder to experience end of life day in and day out. So we have to be more thoughtful. So those economies that we used to see before, that you hire a nurse and you can put her in charge of 6-10 patients right away, is not available when you have newly graduated nurses. So if we take other younger nurses, we will take them, but know that we make an investment in them that is larger than anything we've done before. And this, combined with our reimbursement rates that are not going up, they are actually going down if we look at them with sequestration, is a challenge for our organizations. Another reason not to have other providers, because other providers will take the already scarce labor force out there and make it harder for us. Did I answer your question, Senator?
And I think we can have some follow-up conversation between the hospices and University of Maryland Eastern Shore, and we'll take that as a follow-up.
Thank you.
Senator Mounts.
Thank you, Chairman, and I'll be quick. Senator Crozier, thank you for bringing that up. I just want to reiterate that your workforce right now is in college, community college, and the universities. President Anderson's on UMES. Whether it works or doesn't work, that's where your workforce is right now. That's a reality across the board in every business sector trying to survive post-COVID, as we are still in COVID recovery in every industry. COVID is still a major economic factor on the Eastern Shore. There's no way around that. But and along those lines, Heather, quickly, I think you answered the question about the CON. If the CON goes away, then other providers can come in and further complicate your economic situation. And that's a correct statement, right?
Yes, that is correct.
And I just wanted to, one thing that didn't come up that I've heard is going to be an issue in the legislature is another step at minimum wage. In mandating an escalation in minimum wage. Quickly, can you say whether that be something that you would say right now, absolutely, we can't do that, or is it something that you want to get back to us about?
Well, I'll tell you, I can't speak for the other programs, but I will say that our lowest paid position here at Compass, and probably for the other three organizations, is our certified nursing assistants. And over the years, because of the shortage and competition, trying to retain good quality employees, we have all had to increase our salaries. So it's probably not as big of a stretch for us with the increase of the minimum wage now that it would have been pre-COVID.
Well, thank you for the answer. I would take some time to make sure that's your position, because once that train leaves the station, it doesn't stop.
Right.
So I appreciate you all being here. Yeah, great to see you. Thank you for being here.
You too. Thanks.
Okay, Delegate Hartman and then Delegate Hutchinson afterwards.
Thank you, Mr. Chair. And I want to thank the three of you for presenting today. I think everybody's aware that hospice was a big help to our family recently with my dad and a few years ago with my mom. And I wanted to clarify something, and I think Heather did a good job of doing that. The problem with another provider cherry picking the customers is going to leave you with, the most challenging of patients and make it almost impossible for your existence. So I just want to make sure everybody understands what would happen. And especially, as you said, if it was a for-profit, that would certainly be their business model. And talking to somebody who wanted to address this situation with me, admit it, right out that, yes, that's what they would do. So it is a real concern. And, however we can help, I know I'm there for you, and I'm sure the others are as well. So thanks for being there, and thanks for what you do.
Thank you. And I would just like to make one clarification that I don't think I did make. The Maryland Healthcare Commission's stance on the rationale for wanting to open up the certificate of need is to give patients choice. They say we're all single provider jurisdictions, so we're the only hospice in each one of our counties. So they're saying that patients don't have a choice. If they don't like the hospice, or they had a bad experience, or somebody else did, which rarely ever happens, they feel like people need a choice. Well, the model that we talked about presenting to the Maryland Healthcare Commission, instead of opening up certificate of need, is to help each other out if that need is there. So that will be our stance with them. Thank you.
Thank you. Delegate Hutchinson.
Thank you, Chair. And thank you all for enlightening me about the hospice situations in certainly in my district. I represent 37B, so that's Talbot, Dorchester, Wacomico, and Caroline. And so then my question is really to Monica. And so your comments about the situation in Dorchester resonated with me. And if I heard you correctly, you said that the facilities are at or above state averages in terms of clinical and quality performance. Did I hear that correctly?
Correct. You have that at the top of these fact sheets that we shared electronically.
Okay.
There's a star rating. that the Medicare sends surveys to families that we serve, and they fill out a survey and they respond. And we are a 4-star, 4.7 actually, but they round it to 4 for some reason.
So then can you elaborate a little bit more on the genesis or the background of the state saying that they're not performing correctly?
Right. As Heather said, the Maryland Healthcare Commission thinks that choice is necessary. So they're coming up with a formula to determine low care. But I've inquired about the data that the Maryland Healthcare Commission is utilizing for this formula, and I'm not clear on how they are making this assessment. To me, it makes no sense according to the data that I am seeing, because we are a 4.7-star hospice, and in one county, we're deemed as poor quality, where the data is not broken down by county. So how do you know that this county is poor quality when overall the data is never divided by counties? So that's one of my questions to them. I imagine there are other interests and other forces pushing for the opening of the lower shore, but I can't say, but the formula they are using makes no sense.
Terrific. Monica, could you get me your contact information? I'd like to talk to you offline about a couple of things too. Thank you.
Thank you. Thank you so much for paying attention to this. Thank you.
Delegate Grice.
Thank you. And I'm going to stay off camera because I'm not actually in my office. I'm using the Wi-Fi on my phone here, and sometimes we get cut off. But and I apologize, I'm late, so I didn't hear the majority of the presentation here about the certificate of need. And I believe that this discussion probably originated in Caroline County, I would imagine. Heather, is that correct?
Yes, well, I did talk a little bit about the Caroline County situation and how we're working collaboratively with you and the county commissioners in regards to beds there. But the certificate of need in general, Jeff, is the Maryland Healthcare Commission is always trying to open it up in the state of Maryland. And we've been arguing with them for years to retain the certificate of need. So we're really concerned not only for Caroline County, but the whole shore in regards to it opening, because we're all single provider jurisdictions and they feel like people need choice. So that's why they're looking at all of the single provider jurisdictions across the state. And the majority of us are the ones on the shore. And we know that if that opens, the quality of care is going to go down. We are going to have a hard time retaining staff, especially if it's a for-profit who comes into our areas. And, frankly, we'll have a hard time staying in existence because they will cherry pick patients in our most populated areas, and we'll be driving all the way around to the more rural areas to see patients and provide services.
I heard you say that. No, you did a really good job explaining that. Now, and I appreciate that you're working collaboratively with the commissioners. However, I will say that when our delegation met with them back in, I believe, October, November, one of their legislative requests was very specifically the removal of certificate of need, actually for everything. Right. I don't necessarily agree with that. I think there's a need for hospitals, mainly because we're in a payer system. But hospices aren't in the same situation, or they're not positioned the same as they are with our hospitals. And there's no other industry that's out there in the state of Maryland other than our hospitals and our hospices, where we have the government basically crowding out any sort of competition. I mean, we don't do it for primary care doctors. We don't do it for specialists. We don't do it for, carpenters. We don't do it, we don't do it for any retailers. We don't do it for any other industry. And then, if we do believe in free markets, generally at the end of the day, free markets do produce better results. They do produce innovation. They do, crowd out those organizations that are not efficient, and they're replaced with organizations that are. And competition isn't necessarily a bad thing. And that's the argument that the Caroline County commissioners are making.
Well, right. And I agree with some of that, Jeff, and competition is usually a good thing. But if you look at all the states that have opened up certificate of need, there is fraud and abuse just rampant. And there is not one study out there from any of these states that shows that opening up the certificate of need for hospice and palliative care providers has increased quality. It decreases it. It has not, it's done nothing but create fraud and abuse. Their hospice providers open up and they just have a PO box. They don't even have an office. They're fraudulently billing Medicare and Medicaid for patients that aren't even on their service, or they're not terminally ill people. So there's a lot of other issues that I would also love to talk to you or anybody else offline about. What we're trying to do as a contingent on the Eastern Shore is to give people choice and have a bit of a free market, not opening up the certificate of need, but collaborating among the three organizations to give people choice and provide services as three nonprofit organizations who have been providing services for over 30 years to our communities.
The other issue,
Thank you, Mr. Chairman. That's all.
Delegate Rice, the other issue is competition. I think can improve the service when you have staff. Right, for instance, the only certified palliative care physician in the Lower Shore is Coastal Hospice Chief Medical Officer, and we are trying to create more. We're trying to educate more. We partner with the hospital to graduate more potential palliative care physicians. Palliative care is such a specialty that I don't think in the hospital can speak more on these specialties than I would ever be able to. But it's hard when you don't have so many choices to choose to hire. So you already have limited staff. Competition will just jeopardize that and destroy what we are doing. And frankly, the quality of our hospices speak for themselves. Between 91 and 96% of the families we serve highly recommend our services, where in the rest of the state and the nation, that's in the low 80s. So over 90%. I think we want to preserve these. We have nothing against competition if there were more people in our areas.
Yeah, I would just add, if I could please, the CON discussion is multifaceted. And as several of you have mentioned and offered, we welcome the opportunity to sit with any of you and have a more detailed, in-depth discussion. It is a challenging topic. There are, as I mentioned, many different facets to it, and we welcome the opportunity. So please feel free to reach out to any one of us and we'll be happy to sit with you.
Thank you, Mr. Chairman.
Yep. So seeing no other questions, Heather and Chris and Monica, thank you for the presentation.
Thank you. Thank you all. Have a blessed day.
So members, we're going to turn to the federal partners. We have a new friend today, but we'll start with Mike Arntz with Congressman Andy Harris's office. How are things going in Washington? Mike?
Well, good morning, all. Fortunately, I don't spend a whole lot of time in Washington and spend my time out here in the district. It was great to be amongst the Eastern Shore delegation folks again. I was a little disappointed that we're not doing this in person. Was looking forward to a trip to Annapolis, but this is certainly a good way to do it. Did want to mention one program that's just come out that's now available that you should be aware of for local firefighters and fire departments. It's called the Fiscal Year 2022 Assistance to Firefighters Grant Program. The application period is currently open and will be open until February 10th. There's $324 million available for this in this fund. So encourage any of your folks, any of your fire departments to look into the program. Information about that is available. I think for a lot of folks, it's already been sent out. If you did not receive any information or would like some more information about that program, please feel free to send me an email and I'll be happy to make sure you are included on the distribution list. My email address is mike.arntz@mail.house.gov. And again, great to be with the group again. Thank you.
So we're working on doing this in person, but we'll keep my fingers crossed on that one. Kim Cradaville with Senator Cardin's office. Kim, are you there? There you are.
Yes, good morning.
Good morning.
Everyone. It's nice to see you. I just saw many of you in Annapolis at the Rural Maryland Council breakfast. Just quickly, we are beginning our, we had 2 sessions for nonprofits and 1 for county municipal governments for congressionally directed spending requests, and we're handling those again. So I will send both of those guides to Betsy and for distribution to the group, and please keep in touch. We're setting up individual meetings now, and just keep in touch. I know I'd like to introduce you to Alyssa Hastings. She's Senator Van Hollen's new Eastern Shore representative, my counterpart. Our 2 offices work very closely together regarding congressionally directed spending, and I think Alyssa will probably share a couple of dates with you for something they're doing. So keep in touch. You all know where to find me. Looking forward to working with you through the session.
Thank you very much. And Alyssa, we're happy to see you. And any updates from Senator Van Hollen's office?
Thank you, Chairman, and thank you all for the opportunity to be here. I've connected with many of you, but for others, just wanted to officially introduce myself. I joined the Team Van Hollen in October, so getting up to speed on lots of things, but it's been great to connect with so many of you already so far. And as Kim mentioned, our office is also hosting webinars for our congressionally directed spending process. So we actually have those 2 webinars coming up this week. One is going to be for local governments and the other is for nonprofits. So the webinar for nonprofits is going to be this upcoming Thursday. And then the webinar for local governments is going to be on Friday. Both of those are going to be at 11 a.m. and I can get you the information, and I'll make sure I connect with Betsy to also send out the information if anyone has not received it. I'll also put my email in the chat just to make sure that everyone has my contact information, and I'm really looking forward to working together.
Thank you very much. Any questions of our federal partners? Seeing none. I think 3 of you had different things that we might be able to share with the delegation. Why don't you go ahead and send that, or I'll have my office send you the request for information, and we'll set up a nice, neat little presentation to all our members with the documents that you might have available, whether it's the grants or the meetings that you're talking about, Alyssa. We'll be glad to get that through and let the members distribute as they would like. Okay. So, so members, I guess, and Steve, maybe help me with this. You were the past chairman. Do we open this up for general comment now? You know, are there any other groups that we would open up the floor for that you traditionally ask to speak at this time?
Chris, advice would be is if you want to do that, that's up to you. Sometimes you could take it long and hard on that. We seem to have a little bit of time left on this meeting, so that's really your decision.
Yeah,
Mr. Chairman, I appreciate Dr. Anderson being on the program today and Sharon. We had a nice visit with them last week, and I'd like to give her an opportunity to say a few words about the University of Maryland Eastern Shore.
Okay, Delegate Otto, we'll have Dr. Anderson and Jim Mathias present to the group. Thank you.
Good morning, everyone. Thank you, Delegate Otto, for putting us on the spot. Let me first start by saying thank you to all of our Eastern Shore delegation. For those of you who were here last week, whether you were virtual or in person, we really enjoyed hosting you on our campus. But more importantly, I thank you for all that you do for us and have done for us throughout the years to help us here in our university. I also thank our federal delegation who are on the call today, because we have been able to get help from them from the congressional directed spending that was mentioned by both Alyssa and also Kim. To our Eastern Shore delegation, I also want to remind you, last week when those of you were here in person, we were in our new School of Pharmacy and Health Professions. You helped build that particular phase 1 building. And I think we told you about our need in that building to continue to the phase 2. But more importantly, I just want to remind you, save the date on your calendars. We've sent it to your staff. April 28th is when we will have the official ribbon cutting of that particular building. Speaker of the House, Adrian Jones will be here, as well as our chancellor and our board of regents chair. And so it'll be hopefully we're hoping for not rain that day, but sunshine, and really walk you through that building and let you really see what you helped us build. I think on the call today from our group, obviously we have our Director of Government Affairs, Jim Mathias, and I have my Chief of Staff, Dr. Robert Mock, who's also in charge of strategic initiatives. And the last thing I'll just say, and I think this is where Delegate Otto wanted me to share with you, we're working with the town of Princess Anne to try to do our part as an anchor institution to help revitalize Princess Anne and to bring the town resources and make it more inviting, but more welcoming, but also enhance the economic footprint that's here on the lower Eastern Shore in our counties. So Delegate, thank you for the time, and thank you for all of your service for us.
Jim?
Good morning, Mr. Chairman, members of the delegation, and Madam President. I certainly yield to you and Dr. Mock. I just want to say we are most grateful in a variety of ways. To say the very least, Madam President, her momentum, her leadership, her charisma has created quite a more than a few good things to happen. I'm happy to report we had the highest enrollment since 2015 this year in the fall. And that's, the challenges we've been through, and that's quite a herald of success. We want to thank you again for your support for the HBCU, resolving the HBCU MHEC lawsuit. We started seeing the benefit of that this year in this budget, July 1st. There's so many things that are happening. MOUs are being rewritten. Relationships are being strengthened as we go forward. As you read in the paper with Wallops, with Salisbury, Wicomico Ocean City Airport, with Piedmont. There's a lot of great things that are happening. But something that's coming up soon is we got Greg Porter, the jazz most internationally famous jazz person coming to campus on February the 19th. We'd love to see you there. And that's what it's all about. Town and Gown, President Craig Mathias is working with us with federal relationships to our federal delegation. We thank you for your CDS support. I'll quiet down now. And I just want to tell you the energy's strong. The accomplishments are high because of you, your team, our federal team, and the leadership of the UMES team. I'm always available to be helpful in any way. Thank you so much and have a great session. Good health.
Thank you very much. And Delegate Otto, thanks for keeping me on the straight and narrow so I could have that. Dr. Anderson, you have a world-class, and Jim, a world-class organization there. It's delivering career opportunities that are relevant for the Eastern Shore. It is of just not only regional interest for the Eastern Shore delegation, but national interest. Thank you for everything that you're doing. I've toured these facilities, and when I say world-class, I'm not falling short in that comment. Folks, you should come down and visit. I guarantee you they'll let you get the top-notch tour.
Anytime.
We just got it.
Thank you, Chair.
All right. Just because I'm going to try to do this, I remember back when we were doing it in person. I think we've maybe got the Tri-County Council and Midshore Regional Council, if they'd like to spend a minute or two sharing any updates, if you want. If not, then up to you. Okay. All right. We'll close at the end. So members, when we went through the election back in December, our treasurer, Kevin Hornberger, made a recommendation is that the Eastern Shore delegation consider not only not only supporting legislation, which we have done in the past when it makes sense and when we can get consensus, but in fact, bringing legislation forward that's sponsored by the legislation. Obviously that election didn't lead to the opportunity to have a discussion on that, and I'm unsure how that would work in practice for the membership. And I thought I would just ask the question, first and foremost, is that something that we want to entertain? Maybe the question would be, has the Eastern Shore delegation actually sponsored legislation in the past, and what kind of legislation does that look like? And what's the mood in the room for doing that sort of thing? Because as you know, we're reaching at least on the House side, some hard deadlines as to what we can and can't do to get legislation introduced so it gets a hearing. So I don't know, Kevin, I see you just popped up there. You want to share, you want to kind of lead that, your thoughts on that a little bit more? Because I feel it's important to have that discussion for sure.
Yeah, I think that there's a lot of unity, and at the same time a lot of power that's coalesced in the Eastern Shore delegation. And I truly believe that it's best for our citizens if we leverage that cohesiveness and togetherness that we have in this group of legislators. I think maybe like anything else, we should start with some very small wins. So if there is a certain policy matter that is, uncontroversial and benefits all of our citizens, and we can get unanimous consent from this body, that maybe we do a test run with something easy just to see what that looks like. And then we can kind of go from there, because I do know that there are other delegations that sometimes will put in bills, and it just means a lot more coming from an entire delegation than it does, the individual. So if there's a policy out there that doesn't offend anyone in this caucus, let's try to at least endeavor to put a bill in and get behind it. And I think we'll realize some gains there, and then we can start, realizing the powerhouse that we are. So that's just a recommendation. Again, I'm not looking to offend anybody or put in something controversial. So thank you.
Anybody else have any other thoughts on that before we move on? Anybody opposed to the idea? It seems not. So, from my perspective, Kevin, I would just, or Delegate Hornberger, I would just say that if there's a idea, it's probably just best to get it in front of us, and then we can run it through the members. And, while I think we're running out of time in some respects, surely we can, gear up for next year. And then, as far as support letters, we've had some conversations today with some of these folks that are asking us for letters of support, and I'll try to formulate that in a way that we can discuss next week, and we'll try to keep up to date with that. So if we're going to support legislation or requests coming from the district, that we do that timely for them, and then make sure that we can draw consensus around the issue. So unless there's any other questions about that, I think we'll leave the ball in the membership court as to whether or not we want to sponsor something of a regional variety.
Yeah, and if I may, Mr. Chair, I can go ahead and give a treasurer update. Since
Go right ahead.
Yep, thank you. So we did meet with Delegate Otto, and my staff have been working with the staff of other members to transition. As you know, we have a savings account with local banks so that we don't have to incur fees. We're not a high transaction organization. So we're getting our names added to that account so that we can effectively and in a timely manner, execute payment for anything that the delegation decides on. And we expect to have a full-blown treasurer report by the next meeting.
Okay, sounds good. Sounds good.
So much.
Treasurer Hornberger, what I'll do is I'll follow your lead. I didn't catch at the beginning of the meeting the need to approve December's meeting minutes. So I need a motion to approve December's meeting minutes. These were the meeting minutes that related to the elections for chair, vice chair, and treasurer. Can I get a motion?
Motion to approve.
All right, second.
Second.
All those in favor say aye.
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 All those opposed say no. The ayes have it. Okay. So the balance of the meeting would be open to the members, or if I've missed somebody in the group that would like to spend a minute, then I'll leave the door open. Okay, Mike Arntz.
Yeah, just to get back to you real quickly, I just noticed that my counterpart Keith Graffius is on the call. He had been on another seminar, a webinar this morning, but I see he must have been done and got on. So I thought I'd introduce him, and to anyone that doesn't know him, and see if he has any comments he'd like to make.
Sure. Keith, are you here?
Well, maybe he disappeared. He
That's
was
okay.
there a second ago.
We'll put him on the spot next week.
Okay, good.
All right. Any other business for the good of the order?
Hey,
Mr. Chair. Oh, go ahead.
Okay. So, Speaker Pro Tem.
Oh, sure. Good morning. Thank you. Mike Arntz, can you send the firefighter department information directly to the city of Cambridge if you haven't done so already? They were trying to seek opportunity to purchase another fire truck.
Yeah, absolutely. I think we did assist with one for this past year, but yeah, if you have their specific email address, or would you like me to just send it to you, Delegate Sample Hughes?
Yeah, I think you can just go ahead and send it to the mayor of Cambridge as well as their city manager. The city manager had given us an update on Monday evening. So I know that was something that they are looking forward to potentially purchasing again. And if those funds are available, then they could work on that directly. So if you could contact City of Cambridge directly, that'd be great.
Absolutely. Absolutely.
Thank you.
Yeah.
Delegate Grice, did you want to?
Yeah, just very quickly. I know that Kerwin's on the minds of a lot of us, especially our school boards and our superintendents. So we have a meeting set up. So on the House side, I mean, anyone's invited to certainly attend. Delegate Sample Hughes, Delegate Hartman, and myself, mainly because we're in the education committees, and we certainly want the Speaker Pro Tem to be there as well, for certain, and our senators. So we've invited Kelly Griffith. So she is the chair of ESMEC, and I believe some of our other superintendents will be there. They're going to give them about a half an hour, and then we're also going to have our community action agencies. And what we're going to do is focus on that first pillar, which is 3-year-old pre-K, and that's going to be the biggest challenge for our schools. It's the early head, the folks who do the early head start. They're going to give them about a half an hour. And there's also a partnership with the Salisbury University and a group actually on the Western Shore that works for at-home daycares and also child care providers, like these daycare centers. So we're going to bring them in. And so what I would suggest from our delegation is that we don't want to dismantle Kerwin. In fact, there was a lot of parts of Kerwin that a lot of us liked, some parts we didn't like, but it is the law of the land. So I think it's, important for all of us to figure a way that we can help our school systems, transition into this new reality. I mean, this is the law. So our goal isn't to fight Kerwin. Our goal is to actually, work with our school systems to help implement it. And so what this meeting is going to be focused on implementing that first pillar of Kerwin. And then so this is the day before our final January Eastern Shore delegation meeting. So I just want to make you all aware. You all are anybody's certainly invited to attend if you'd like.
Delegate Bryce. No, go ahead. Who was that?
Johnny. When was the meeting?
Whatever the date is, it's the last Thursday of the month. So we meet on Friday. It's the day before that. We're meeting in the morning. I think it's 8:30 in the morning on that Thursday. And we're going to try to do it in the appropriations committee hearing room. So that way we can do both Zoom and in person.
Yeah. So Delegate Grace, if you want to send that to me or Betsy,
I can do that.
We'll send something that looks appropriate, and we'll catch their attention.
Absolutely.
For that date.
All right, we'll do. Thank you.
It's January 26th, just for clarification, 8:30.
Okay, anything else for the good of the order? I need a motion to adjourn.
So moved.
Second. Okay, we've got a second. Okay, see everybody next week.